of my bicep. Okay, my short head goes over here to my coracoid, which nice and relaxed. It's going to be a disaster when it comes to palpation for Sherry.
He doesn't know how to relax.
Exactly.
God, no, man.
That's the short head. What was the question you guys asked me?
Short head.
How do you palpate your ribs so easily?
Okay, I palpate the rib is easily because on the second one, we're actually putting an electrode for 8 kgs. So,
Oh yeah, that's right.
so it's easy. 1, 2, I'm just so used to putting them on. So, okay,
His
so what we'll
humeral,
focus on-
we're on humeral head.
Humeral head, okay, so this is my humeral head, okay? So if I palpate up, right, here's my deltoid, and here's the actual head itself, okay? He has a lot of musculature on it, okay? Can I have you at the end of the table so I can show them? I can turn this way. Okay. Okay, so if I'm looking here, okay, and this is his humeral head. So if I want to move his humeral head, I can do that. That's anterior, that's posterior, okay? I can do that. That's not painful for him. It has a little bit of movement, and that's normal. Okay, so that's my humeral head. If I want to find my greater, okay, see when I do that and see how it snaps? Okay, greater, lesser, in between, long head of the bicep. Next.
Greater and lesser tuberosity.
Did those?
Bicipital groove
Okay, where's my bicipital groove? Turn towards me.
between the two.
It's between the two. So I'm putting myself in anatomical position. Okay. Looking in this area right here. Okay. Here's my greater. Tighten your bicep for me. Tighten this right here. Good. Good. Relaxed. Tighten again. Relaxed. Tighten
What
again.
is that?
That's his bicep. That's all it is. See how I'm pushing him pretty hard. Squeeze again. Okay, it just pops out. Okay? So for him, it's easy to find. Okay, it's going to be super easy to find that on Melissa. It's going to be super easy to find it on Andrea, probably on Erica, Nicole. Super easy to find them. Why? Because they're petite. It's going to be easy.
Girl
to find
power.
Okay.
Girl
What
power.
else?
Long head of the biceps.
Long head of the bicep. Okay, so long head of the bicep comes in through here, all the way to the tippy top. So it comes up into the actual shoulder and attaches at the top. Okay, so my bicipital groove.
Humeral shaft.
My humeral shaft, this is my shaft.
Pectoralis major.
Pec major. Okay, pec
Your
major
boobie.
goes from here to here, a little bit on the cartilage, and comes all the way to here.
Anterior, middle, and posterior deltoid.
Deltoids?
Yeah.
Yeah.
Okay. So my deltoids are fine, okay? They sit right here. That's my middle. Okay, this is my anterior, this is my posterior. Okay? So if I want to touch the anterior, okay, this is his anterior.
Oh
If I
my
want to manual
God.
muscle test it, okay, he's right here. And I can touch it, it's hard. Okay? If I want to do middle, okay, hold only move you. It's hard. If I want to do back, okay, it just pops right out.
You've got to be kidding me. Do you work on every single deltoid? Anterior deltoid?
Oh my God.
You're nuts.
Spine of the scapula.
Spine of the scapula. Okay, I'm going to have you turn backwards for me.
Nuts.
Okay? The spine of the scapula is going to be one of the biggest projections you're going to see. Keep it on the same side. Okay? If you have a tankini, it makes it easier. Let's say you don't.
Just take your shirt off.
Okay? Remember, it's going to start,
Oh,
your actual scapula starts at T2 to T7. Okay? So if I'm here, 1, 2, that's 3, 4, 5, 6, 7.
Educational
So it's going
video.
to sit in these two positions. Okay? So that's one way of finding where it sits. At T3, okay, at T3, if I come across, I'm going to find a nice ledge. Okay? That ledge is going to be my spine. The closer you come distally, you're going to feel it. So it's going to be right here. So can you see that?
Mm-hmm.
Oh yeah.
Okay, top, supraspinatus, infraspinatus, this is the actual bone. Okay, he's got a lot of musculature, so that's why I wanted to make sure I showed him, so it's a little harder in the back to find things. Okay, if you still can't find it and it's a normal patient, take your arm, just bring it back for me. Okay, and if you do that, okay, it pops right out, it's right there. Relax.
Vertebral border of the scapula.
Vertebral border. Here's my scapula, right? Relax your shoulder, drop it. Okay. vertebral area is right here. So you're actually palpating this area. All the way here. Okay? Lateral border is right here. Okay? Vertebral border, lateral border. Superior border, you're going to feel at the top. It's a little hard to palpate because he is very muscular. Find T2 and come across. That's the superior border.
You're so smart.
Supraspinatus.
Practice, that's all.
Supra and infraspinatus.
Okay,
Good job.
supraspinatus.
This.
Okay?
That's
Find
her
my
job.
spine. Where do I find my spine? What level? 3. Gotta find it across. I now have my spine. Okay? If you want to change it and do it in this area where you find the spine of the scapula and go right above and say that's supraspinatus. Okay? This is infraspinatus. Okay? Here, right here is your teres minor. Teres major is here. Okay? Teres major not part of the rotator cuff. Okay? If you want to do your lats are here, attaching to my hip and coming all the way up, and attaching right here. Okay, teres major, okay, attaching in the same spot. Supraspinatus, greater 2, infraspinatus, teres minor, greater 2. Infraspinatus and teres minor, greater 2. On the front, okay, my subscapularis attaches to my lesser.
Teres major.
Okay, teres major we did.
Rhomboid major and minor.
Rhomboid major and minor. Which one is on top? Which one's on the bottom?
Minor's on top.
Okay, minor's on top. So what I'm going to do is I'm going to palpate my vertebral border. Okay, so here I am. Okay, and it's going to sit here. My major is here. Okay, when I'm in this position, if I go to the tippy top of my superior border and my vertebral border meet right here, that's where I'm going to have my levator scapulae. The levator scapulae brings my shoulder blade up. Okay, bring this up. Okay, tilt your head towards me. Okay, when I resist that, okay, just gently, and you palpate in here, it's right there, okay? It's probably uncomfortable for him, okay, for me to go ahead and put my finger in here. The big muscle is going to be my trap, my upper trap. But that little levator, that's what it does. It just kind of brings that shoulder blade up a bit and the neck down just a tiny little bit. Very, very similar to trap, the upper trap.
Traps were next.
Okay, so trap, that's my upper trap. My middle trap is right here. Okay, my lower trap is here. Okay, so lower trap, middle trap, upper trap.
Triceps brachii, lateral, medial, and long.
Sure. So I'm going to go ahead and what I'm going to do is I'm actually going to roll this up. It's fine. Okay. But what I want you to do is I want you to take your hand like this and I want you to push into your natural thumb. There you go. Awesome. Okay.
I'm just
So
excited
I'm going
to
to
be
have
next
my
to Erica.
lateral one. My
Doing my
lateral
job.
one comes here. My medial one comes here. My long, remember on this side it's out here. The long this time comes up right over here to my actual shoulder blade. So if I palpate right there,
Or like a
okay,
vanilla Oreo.
that's where the long head of the tricep goes. Lateral, medial, long.
Cervical spine. Spinous processes.
Cervical spine.
Mm-hmm.
Okay, so are my spinous processes easy to find, okay? Remember, C1 and C2, you are not going to feel a spinous process. If you're lucky, you'll be able to get to C3. If not, you'll be able to see 4, 5, 6, 7, and go down from there, okay? So you can have him tilt his neck forward, or if we're actually on the field, normally, he's looking at my shoulder, and I'm palpating him this way. So I know what's going on, okay? Usually, right there, that's going to be 3, 4, 5, 6, 7. Okay, how do I know it's 7?
Big.
Pops out the
For
most.
the video?
Okay, so if I'm looking at my C1 transverse, okay, you have to get close to the actual bone. Okay, so here I am. Okay, rotate right and left.
Rotate.
Okay, and I see it. Okay, you may not be able to feel 2, but you should be able to get into 3, but definitely 4, 5, 6, and 7. They're right there.
IVD.
Okay, my intervertebral disc sits between 2 spinous processes. Okay, so it doesn't make a difference which one I'm looking at, but I'll pick 2 that are evident. Okay, so I'm right here and right here. These are 2 spinous processes. In the middle, I'm going to have my. Sorry, those 2 are close together. Do you have neck pain, like arm pain? Here to here. Okay, there's a space in between. This one and this one, they're so close together. He probably has some sort of nerve impingement that goes down his arm, giving him some problems. Okay, so just right there. They're just all close.
Transverse processes of the cervical spine.
Did those.
Thoracic spine, spinous processes.
Did those.
Transverse processes. All right, we're done.
What was the IVD of the cervical spine?